Hi, yes, I'm Johan Biput. I was diagnosed with juvenile rheumatoid arthritis at the age of 7, and well, it's been a long journey. I'm not going to do the maths right now, but I'm currently 21, and so I'm here to discuss my story on how that journey has gone from then until now, and how Fracture and Orthopaedic Clinic and Dr. Derrick Lousaing has assisted me with that by major surgery done, and has gotten me to this point where I am a successful athlete in CrossFit and hope to be a successful athlete in track and field soon enough. Um, uh, the disease really started when I was 7, started bothering my ankle. And I was young, so it wasn't really anything that I knew how to handle and so on. It was very, being a young person and going through something like that, you don't know what is going on. You don't know how to handle it, you don't know how to tell people, and of course, in primary school, I was known as the guy that was always injured. That was just easier to explain because people were like, why are you making so much noise? Why are you in pain? Why are you missing so much days of school? And especially when I was being diagnosed, I think I missed about a year of school because, well, they kept me quarantined and all that, did all these tests for different cancers and this biopsies, this, that, and the other. And so there was a lot of question around what's going on with me, and I, of course, didn't know how to explain myself, even though I knew it was this thing called juvenile rheumatoid arthritis. And from there on, it was just like random flare-ups. I was taken back at times away from sports. I was very in love with sports. I was very in love with PE. I did hockey, I played football, did swimming, I did taekwondo, which I all loved. And then slowly and surely that started to take away from me. It started to just be taken away from me slowly. And of course I wanted to be competitive. I always wanted to be an athlete. So I always had a dream of being an athlete. And of course at that age, people always ask you, what you would like to be when you want to grow up. And I always wanted to be some sort of athlete, whether it was football or whatever it is. I always wanted to be an athlete. And it was quite the journey. It's quite a slow journey. But it really impacts my life on all scales, whether it was socially, because I was young, so I was growing, and then once I got into my teens, you start to socialize a little more, you want to go out to parties, you want to go and hang out with friends, you want to go and take a sweat, play football, that sort of thing. It took a lot, it took a lot of understanding from myself, because I didn't know how to deal with it at the time, my parents didn't know how to deal with it, and it was a weird thing. It was a weird thing. And well, what motivated? I mean, it wasn't motivation, so to say, but it was more like, is either I want to live like this or I want to get better. So the option presented to me, well, it was given to me from my rheumatologist, from Dr. Peter Poonking, who recommended I go and see a bone specialist, a joint specialist, to consider the option of surgery since my hips started giving away. It started deteriorating slowly because of the arthritis, and well, because I had arthritis and the sports I did, it started deteriorating. So the option came up that I might need to have surgery done, and that was the case. I did need to have both of my hips replaced. Originally it was not both, it was just one, and then the next one came the following year. I mean, you might call it bad timing, but it seemed to be perfect timing because I did have to take, well, Dr. Lousaing did say that, it might be better to take a year since I was so young. Hopefully let me grow as much as possible, let me develop as much as possible so there will be less complications, hopefully. So yeah, it was a year, so it was about 2 years where I was on crutches. I was assisted by crutches only, and it wasn't even walking, it was more like swinging. So this was throughout my Form 4 to Form 5 year. So I missed a lot of school, I missed a lot of classes, very uncomfortable sitting down in front of classes. You already have to learn these things and go through the stress of doing exams and tests and dealing with teachers and that sort of thing, and then moving from class to class, because I went Fatima College, so you have to move from class to class when you reach Form 4. So it was quite a time, and there was days that I really did not want to go to school because I didn't see the sense of me going to the school and sitting down in class, and I knew I wouldn't absorb anything because I was in so much pain. So once I heard that there was an option to get away from this pain, and what I considered suffering at the time was to do double hip replacements. On seeing Dr. Lousaing and hearing, I might have to wait a year, it was very sad to me. I was in a state for a little bit because I was like, okay, I have to wait another year. It's going to be another journey. I'm going to deal with all this. I might be behind. I might miss class with my friends. They might ask me to repeat. and that sort of thing. So then the day came where he finally announced, I believe this was in 2016, 2017, one of those 2 years. And I was allowed to have it within 6 months span of each. I think one is April the 16th and the next one was July the 26th. I may have those dates reversed, but it was within those 2-month periods. And from there on, I didn't want to wait any longer. I don't think I had an option at the time, to be honest. I don't remember, I just remember I heard about this place called Orthopaedic Clinic and Dr. Derrick Lousaing. So I was like, okay, I was excited. And once I met Dr. Lousaing, I felt like, okay, this is the doctor. This is the doctor to do it. He was very cool. I would very much recommend him to any young person because he greeted me with a bounce, and I was just like, this is, at that stage in my life, I was like, this is a big man. He's a doctor, he's a surgeon, and he's greeting me with a bounce. So I felt like, okay, this guy is cool. This guy is pretty cool. So the surgery itself, it was quite the experience. It had a lot of ups, it had a lot of downs. Jokingly enough, because I had to do prep and course in therapy and so on, strengthen the muscles around it because I was very weak. My legs were very weak, and after the surgery, you have to get up and walk within a few hours after to make sure everything is moving. You have to start moving one time so nothing wouldn't seize up. All those things along those lines that I wouldn't know medically, but. So the surgery itself, it had its points in time, but my physiotherapist jokingly says, I think you're the only person I know that is happy to go in surgery because I was just ready to get over and done it. I wanted to start my new journey, and the fact that the date was staring me in the face. I wanted to be in an operation. I wanted to be under. I wanted to wake up with my new hips and so on. But of course, until you experience it, you'll never know what it's like to be under. And I think one of the most positive things from me was, jokingly, is that, being under anesthesia was one of the best sleeps of my life. So I never forget that. That's one of the factors I never forget. But besides that, the surgery itself was going to be tough. We knew that going into it because my hips were in such a deteriorated state, especially my left hip was quite deteriorated. It was pretty bad. That was I experienced the most pain, the most limitation in mobility, everything. So I decided to attack that one first. Post-surgery, it was a planned expectations of a little leg length difference. It's because I was so young and so on. So there was a little leg length difference between my left leg and my right leg, but my right leg still had to be operated on. So that was catered towards later on. But of course, having to get up and walk and do physical therapy for the next 3 months just for the left hip alone came with some challenges. You had to get shoes with heights attached to it, that sort of thing. So it was something to get used to because I never experienced anything like this, and of course the body never experienced like this. So even under the trauma of after surgery, you have to go through all that. You have to go through all the tiredness, the fatigue, the anesthesia wear off, all those small things. So all that came with its challenges, but I had to just keep reminding myself to bring back that athlete mindset within myself that everything is a process. There's a process. There was points in time where I felt like I took 10 steps back because I wasn't allowed to move around as much as possible. I was experiencing so much pain, so much discomfort, but that was just all the healing process taking place. And that's why I just had to remind myself. Luckily, I was put on, I believe through fracture orthopedic clinic, they put me on to somebody that they operated on. He was older than me, but I think he was one of the younger patients who had one hip replacement surgery done, and he gave me his number. He said, call him if there are any problems and stuff. I did. I messaged him. I called him. I told him I was having a hard time, and to remind me, he was just like, it's all part of the process. This happened to him. Just keep patient, keep with the process, keep with the therapy, and just keep going. And that was a huge help and support. Second surgery came. The right leg was like nothing. It was like, okay, we knew what to expect. We knew the pain I was gonna feel. Now the leg length differences evened out. Everything was smooth sailing. Renee was the stronger leg, so it was much easier to get up and walk with that. I think I was walking too fast at point in time. The physiotherapist would be like, oh no, slow down. Your hip still has to heal. You don't want to dislocate, anything like that. But the support of Dr. Lousaing, support of the nurses here, and so on were extremely. It was huge. It was a huge contribution to me as a person. Dr. Lousaing, once I met him, I said this earlier, he was a cool guy. He greeted me with a bounce. At that point in time, I was like, there's a surgeon, there's a huge surgeon who's greeting me with a bounce thing, but he was very cool, he was very confident. I had no doubts in him being my surgeon and him being able to do what he did, because he was, he told me that I think I'm the youngest person he's operated on in this kind of surgery, and well, double hip replacements at that too. So it was some, I mean, it was a historic thing. So I'm glad that I was able to be that person, and that I'm able to demonstrate what he has done for me today. I would say yes. I think that was the worst position of the disease, because it seems like the deterioration was it's taking its mark. It was taking the heights of what it was supposed to take. It really, and I could say that confidently, even through, there was a spike in medication, there was a spike in steroidal use and so on, just to make me feel comfortable as possible, because the pain was so drastic. The pain was quite painful, quite painful. But yeah, it was the worst part, I think, of my experience with it so far. Yeah, so I really, since Dr. Lousaing was such instrumental in this process, because without deciding to do hip replacement, without his plan and what he has put in place, I wouldn't have been here today where I am. Without the hip replacement, I wouldn't have been, without his construction and the hip replacements. Because even as some people see the hip replacements through the x-rays and they're like, wow, that does really good compared to what you see other doctors do down there. Not bad talking to anybody, but yeah. Through the eyes of other doctors and other surgeons and so on, I'm like, okay, this guy really did his best. He really took it to another level, because it could have been much worse. It could have been a whole different story, but he did it. He took up the opportunity and he did it, which is what I'm appreciative for. So him being able to do that for me, it makes me want to do something for him. So of course I want to demonstrate through myself the discipline I gained through it, through the opportunities I gained through it, and more, like bringing home that Paralympic medal for him, for bringing home something for him, because I don't want to go in vain. It's not something that should go in vain. It was such a big opportunity that I gained, and I was lucky to find him, so it should not go in vain. So everything that I do, he is one of the main people that I contribute his name for. He's the one of the main people that I think about when I go and do anything, whether it's from the marathon, whether it's from going to Paris, when it's training, whether it's from days that I feel like I don't want to train, or I don't want to eat, or I don't want to do this, I don't want to do, I'm tired, this and the other. I have people that I have told myself are counting on me. They are counting on me. They have done these things for me. I'm not going to fail them. Definitely. I mean, right from before surgery, even up to now, there's always points of reflection. I always have points of reflection, whether it's good or bad moments. With this one choice, because I'm a big believer in that the choices that you make, it affects your future. Whatever choice you make now, it has a big decision on the future and the next steps that you make. So the decision to come here and do the surgery, and to accept Dr. Lousaing as my surgeon, it has made a huge impact on my life, as well as my other coaches, through CrossFit, through track and field, well, now currently track and field, through my physiotherapist. Everybody has played such a big part, just from this one decision, and my decision to start in CrossFit and so on. So even after every event, the first 5K, that was a big event. I reflected on that, and I was like, okay, and I just have to keep going. And then after that, it was just 5Ks. After 5Ks, I wanted to get faster. I wanted to better my times. I joined the sport of CrossFit. I wanted to be a CrossFit athlete. I started CrossFit. I competed as an adaptive athlete for them. If you don't know what adaptive is, it's also paras. It's just called an adapter in CrossFit. And by my second year of competing, I was able to place 10th in the world as a para athlete. And well, first in Trinidad and first in the Caribbean. So I was very impressed with that. Just to look back on that and be like, okay, well, just keep going. Whatever I'm doing, it seems to be working. It's helping my health on a whole. Everybody's surprised. My coach always tells me that I have a mindset that nobody else would understand. And I didn't believe it back then, but I could see what he's talking about now. That nothing really stops me. And from there, I just wanted to do more. And I guess because I had that time of 2 years and not being able to walk properly, and looking the fact that I might not be able to walk properly in the face, I wanted to do more. So then I decided, okay, I want to do a marathon. I decided to do a marathon. I did it, this was last year, January or February, the Trinidad and Tobago International Marathon. I ended up running it. I got a cramp, so I had to walk back the last 13 miles. But the fact that I finished and I could add that to myself and as an accomplishment, I reflected on my choices and everything that I did before that and how it led up to there, because without all the steps that was taken and the decision was made, from coming to fracture and orthopedic clinic to joining sports, to strengthening myself, to keep going and finding ways to better my health and the arthritis without any set guidelines on how to deal with the disease, and besides meds and pain management and that sort of thing, it is doing something well for me and it's doing positive things. And from now, where we reach the point where I'm being considered to be sent as like a para athlete for track and field. So to have people look towards me and be like, he has the potential for something. Whereas before it was just a simple act of I just want to accomplish these things for myself. Whereas I see other people believing in me now, and they kind of believe what they're seeing in front of them. Even when I saw Doc's face, when I saw him near Dr. Lousaing, that is, and he was just astonished by how the progress that I made, because this is not supposed to happen. It's supposed to be a degenerative disease, but it seems I'm battling it and I'm winning the fight. So the recovery process has been quite the one. Looking back on it now, I would have never saw myself being where I am right now and where I hope to be in the future from now, even within this year span. The recovery process, it was very random. It was a lot, I met coaches, I met people who wanted to take on the challenge. It basically started from therapy. So once post-op, just went to therapy, did whatever I had to do the little exercise, keep my hips strengthened, make sure I didn't pass 90 degrees for the 3-month period, and so on. And from there, I felt I started getting better, started getting stronger. I was able to walk on my own. I was able to be more independent. I didn't have to worry about anything anymore. So for me, it really began with Fatima's 5K. Fatima had a 5K. I never got to do 5K since I've been in Fatima because of all this drama. I was either in the hospital, I was either somewhere when this 5K was happening and unable to do it. And that time, my house, the house St. Matthew, it was such a prideful thing to be supporting your house in the school, and I never got a chance to support my house in that way. So I told my dean, I was like, sir, I want to do this 5K, I'm going to do it. He was like, okay, well, let's see. I was like, I'm going to walk it, whatever it is. I ended up walking the 5K, I ended up truly finishing. It took me an hour and 9 minutes, and I was happy that I finished. It was a huge struggle. I was quite in a state after, physically, because coming off of surgery. And I think this was 3 months after the surgery. I think it was almost exact 3 months, because I asked my physiotherapist, and he was like, I asked him, I was like, do you think I could walk the 5K? He was like, well, if you're confident enough, and well, you're outside the 3-month period where there's any risk, train for it, go on the treadmill, went on the treadmill every single day. We walked. He was like, how are you feeling? Are you fatigued? Are you tired? We don't even dropping down. What do we have to strengthen? This, that, and the other. And it was so said, so done. Luckily, I had classmates that supported me. They were with me along the way. So if anything happened, they're at least there. And it was guys who could have handled themselves. And yeah, I was able to finish. The disease is still active, yes, but it's doing amazing. The levels have shut down. I can't remember the exact numbers on the scale, how it will be, but let's say it was at 100 at the time the hip surgery had occurred. It's down to about 8 at this point in time. We put it on a scale to 8 being good, 100 being bad. So it has progressed. Just with me, and my doctor uses it like this. He says, you're burning it off, so to say, in just the activities that I'm doing and are able to do because I've taken these steps. No, just one painkiller, Olfin, 50 mgs, and that's it. Everything else is fully training, stretching, strength training, and of course physical therapy, mobility. I would never forget about that. I think everybody at a point in time in the world that we live in, especially working long hours in offices and so on, sitting down, you're going to have to do some sort of physical therapy or strength training just to keep your body aligned and proper and keep those muscles, that small muscles that you're not even aware from wearing away or causing deterioration to your own body. So those are the factors that can lead you to not having to have replacements and so on. But to have the replacement is just as good. I would definitely say seek it. Even if it's just a consultation and you're not even fully, there for it as yet, I would say seek it. I think it could be your best opportunity and for a better life, because you could see I wasn't even sure about it. I mean, I wasn't even knowledgeable. I was so young with it already, and I'm able to do these things I can do now, rather than waiting too long to the point where you're lowering your lifestyle levels just to cope with whatever pain or whatever experience you're dealing with. I think it is worthwhile. It is very much worthwhile to your long-term health and longevity. If I had to, people ask me, of course, because they think about themselves in my shoes. They watch me, whether if I'm training, I'm doing things that are unbelievable or so on. They ask me if I would have gone back, or if a genie came out to me and told me, if I had a wish to not have all of this happen, if I would have taken it. I told them no, because I tell them no every single time, because it has groomed me to be the person I am. The decisions I made, when it came from being diagnosed with arthritis to having to have the hip replacement, it has contributed me overall as a person, and that has reflected onto sport having control over me as a person, and the beneficial it has to me. There's actually a word I would love to share that I learned in sport history class that had a lot of influence on me and sticks with me. It's something I actually want to keep with me. I have it sticked up on my wall in my house. It's called Arhritis, and it's called excellence. It's used by the Greeks, who in the past, in historical times, used it for the Olympics and so on, because they strove for excellence in everything that they do, whether it was building their bodies, whether it was displaying it out in the field with themselves. So I strive for that. I strive for excellence. So I always tell myself Arhritis, because I'm striving for excellence in any way that I can. So I would not hold myself back to get the opportunity to do another replacement when I need to, because of course I still suffer with the juvenile rheumatoid arthritis. So it is a degenerative disease, but seeing the impact it had on me from then until now, and the things that I could be able to do now that I could not have been possible if I had not done it, I would not second guess it ever. So I usually have moments where I reflect back, because especially in these times where a lot of major things are happening, where with a PR 5K, when I ran the marathon and so on, there will be moments of gratefulness that will last days and days and days. And I reflect back and look how far I've come. Imagine how far I've gone, which is one of my favorite quotes, by the way. And I was finishing up training today, and everything just started hitting me, because of course my training plan has changed to a much more balanced one right now, because I'm managing the CrossFit with track and trying to keep both hand in hand, because they both have got me to where I am today. And I finished it, and I was sitting on the row, I was drinking my water, and I got into this deep mindset. I could see myself in the podium, I could see myself at Paralympics, I could see myself qualifying, I could see myself bringing home that gold through the airport doors and people waiting there and celebrating. So it was quite a deep moment. So though it was such a deep moment, I don't think I've ever experienced something so deep in my life. My coach was even in the office, and he could see me through the glass pane, and he came in, he's like, "You all right?" And it kind of snapped me back to reality. And I was like, I just went somewhere pretty deep there. I think I was even getting emotional, but I was able to hold back the tears pretty wild. I was in front of people. But it was quite a moment, and I love having moments like that to remind yourself to keep doing what you're doing, to keep doing what I'm doing, to keep working hard, to keep demonstrating myself, to keep the discipline, and to keep everything that I'm doing, to work for it, to ask, to get whatever, to work towards these sponsorships, to work towards scholarships, to work towards school, to work towards education, to work towards making the Paralympics, to making these achievements, not only for myself, but for the country, for the people that believed in me, that put effort behind me, that put their work behind me, the things they have worked, such as Dr. Lousaing, who has worked tirelessly years, whether it's education or teaching or practice, to do what he was able to do. I want to be able to do that, and not only for myself, but for the gain whatever knowledge and experience I can to pass it on to when I can bring it back to Trinidad, can pass it on to other athletes, whether they're in their full regular athletes on the field, and that's what I hope to do for my teammates as well. So I think everybody should have times of reflection, but that was one of the deepest ones I think I experienced since the talk happened about, considering Paralympics, considering a para-athlete for track and so on. So it was quite a deep moment. I thought I would have shared that. So right now I'm studying sports kinetics at the Sports Academy in UE, St. Augustine. Currently, I'm really enjoying it. I think I found my niche because it really surrounds me whole as a person. The hope is after I finish this degree, to head across to London, hopefully, to study sports and exercise science as a master's, so I can further educate myself and how to treat athletes, deal with athletes, and studying the masters will hopefully allow me to be able to treat athletes, travel with them, such as like what you see with cricket teams, you see physios, travel with them, sports and exercise, coaching, those kind of things. So that is the hope. Of course, financial constraints do exist. That is the reality of the world. So it does, limit chances of things happening. But the hope is that, either by corporate sponsorships, by scholarships from the university, by scholarships from other places, but I know something will work out. Something will definitely work out, because this is the path that I'm going along, and it seems to be what is for me and what is to come. I do take a passion behind it, not only as an athlete myself, to teach myself these things and get any experience I can, but to also, so later on, even after I retire a while and being an athlete, to help others, and especially for persons like myself, such as para-athletes or adaptive athletes. And that passion and inspiration really comes from my coach, my new track coach that I joined the team with at the UE, Jehu Gordon, who is a world champion. And I think he's the only hurdler for Trinidad who's been a world champion, I believe. And I believe he also did my same degree sports kinetics at UE Spec. And he's now giving back to UE by coaching us in the track team, which is, I think he's the best coach that I could have been put with. So everything happens for a reason. So he was a student himself, he was an athlete himself, and now he's a coach. So he's able to relay certain teachings and knowledge that he as an athlete has done himself, and his coaching methods are quite there. And him himself, he always says, he hasn't dealt with para-athletes or adaptive athletes, but he has taken the opportunity to, to coach me, to see who I am. And I always tell him, coach, if I'm not worried, I don't think you should be worried. So whatever you give me to do, I will do it, and I'll do it to the best possible ability. So I want to almost mirror him in giving back, and while starting my own mission of helping para-athletes in Trinidad and adaptives, and even setting up any sort of training plan, any sort of, in bringing back some knowledge that we may not have here and seem to not have, because I myself was without it. It was just go out, see what I could find, what I was interested in, see if I could turn it into something, test and try. So I was lucky to have those opportunities when I went on and searched for people who wanted to pick up the interesting opportunity in training me and seeing where we can go from there. In 10 years, I hope to be a successful athlete. I hope to be an Olympian. I hope to bring back something for my country. And I hope to bring something to this country to help para-athletes and adaptive athletes, and even patients with GRA and RA, because it's not an easy process on your own. So if I could bring back something to help and contribute something to this country, it would mean a lot to me, because there's not much we have here for it. So any little assistance that anybody can get, I will be appreciated to do so. And will show them that nothing is impossible. Whatever dreams that you have, keep it, trust in it, just trust the process. It's a long road. I never saw myself where I am now. I had always hoped it, I always dreamed of it, but I never gave up on that dream, clearly. And it just took many different steps and choices and decisions, from making a decision to come here to making decisions to do these things now and go forward with it, and putting all the training and the time to just keep going. And I know in 10 years from now, those things will happen, and I will be able to do the same for other people. I will be able to contribute towards them and hopefully make them as successful and conquer their dreams.